Ladies,
Sorry. 2 things about the abdominal exam. There are 2 maneuvers that are going to soften the abdominal musculature. Having the person's knees bent, please, slightly like that, and flexion of the head. Okay, good. Now, what's the first thing I do with the abdominal exam?
drape.
I inspect, right? Now, I also like to drape patients. Yeah? Thank you. So we're going to inspect. Thank you. Now the abdomen is rounded. Thank you very much. The abdomen is rounded. And one of the things that I look for would be symmetry or asymmetry. I don't see any bulging that would suggest underlying masses. I don't see any of the stigmata of liver disease. And what am I thinking? Caput medusa. I'm thinking of superficial varicosities on the abdomen. Now, the next thing I'm going to look for is the aortic pulsation. Now, we expect it to go up. Now, we would expect it slightly to the left of midline. Now, as she exhales, it's most notable right there. Okay? Now, I want to map out where the major arteries are, where you're going to be auscultating for me, and I don't care that it's not on the practicum, because I expect you to know what you're doing. So, here's the abdominal aorta right there. Now, these are easy landmarks. In between the bottom of the thorax, last rib, and the belly button, at approximately where the midclavicular lines extend into the abdomen, you have the renal arteries. Now, using similar landmarks to create another box, we're going to use the umbilicus and the top of the hip, the ischial spine there. Now, from spine to spine, we now have a little box. So, following those lines down, we now have the iliac arteries, and then the femorals, okay? So I'm going to auscultate first. If I palpate or percuss, I can change the vowel sounds, can't I? So I always start at the ileocecal valve, which is here. And I'm noting that I have a diagonal surgical incision at the right upper quad. Now, I would expect to hear vowel sounds, but I want you to listen for bruits, which would mean that we may have an aneurysm or possibly a plaque present. So I'm going to listen over the abdominal aorta, and I want you to tell me what you're doing. The 2 renal arteries, the iliac arteries. Now, this is a combination of palpation and auscultation. Palpate both femoral arteries and listen. Yes? Okay, now I'm ready for either percussion or palpation. I don't care what you do, but we should let the patient know. Now I'm going to percuss gently, all right? Now I do concentric circles, but you do need to cover. Now she's tympanic. A little dull on the left lower quad, which is to be expected. A little dull over the central area, which is more than likely urine. Okay, now I'm going to actually do liver span, and we expect it to be between 6 and 12 centimeters in height. Now, I'll show you several ways to approach a liver span. So first of all, let's use the percussion method. We're going to go from sounds we know to sounds that change. So we percuss from tympani at the midclavicular line up to dulnus. These are ribs. Now that's distinctly dull. Did everybody hear the difference? Okay, I mean it's very obvious. So now what we're going to do is start in the lungs, which we know the sound. That's pretty So her liver span is this, which is about 6 centimeters at the midclavicular line. Now we can do the same for the spleen. Now remember, the spleen is going to be at the anterior axillary line, a little bit behind, and what we do is we have the patient come toward us. There we go. And again, which way do the ribs point? Remember, on the sides of the chest, they point down and then they go up, right? So, let's see. Did you hear the drop in sound? So it's right there. Alright, now, so we've got liver span, we've located the spleen, now I'm ready for light palpation. Now, any pain, discomfort? Yep. Good. Okay. Now, I'm going to do deep palpation for the liver. Now, I'm going to put my hand under here. Now, you don't have to help. Now, I'm going to use her inspiratory movements to make the liver come down to my examining hand. This is really important. Most people screw this up. Now, as she inhales, the liver comes down. I don't want to stick my fingers in then. So what I do is I have my fingers waiting for when the liver comes down. So when you exhale, liver goes up. When you inhale and hold it, liver comes down. Now I palpate. So there's no Murphy's, no inspiratory arrest. Great. Now this side, I'll do the same thing. Inhale, exhale. Okay. Inhale, hold it. Okay, so there's no splenomegaly or hepatomegaly. And I'm going to show you.
Could you feel it? I'm sorry, excuse me, could you feel her spleen?
You shouldn't be able to feel this. It would have to be 2 to 3 times its normal size to feel it. Now I like to do what's called the liver scratch. And for those of you that bothered to bring your stethoscope, you're really going to like this. If someone has ascites or has the quinta llanta, you know, they've got a lot of adipose here, that's the 5th tire. What happens is that we can't sometimes really hear the percussion sound. So what we can do is we can use the liver scratch test. So you put your stethoscope, the diaphragm, over where you know the liver is, and then you scratch up. And where the scratching becomes suddenly louder, that's the lower edge of the liver. Pretty nice. Okay, now there were a few other signs on your practicum that I'd like you to be able to at least verbalize. So look at your practicum carefully, so as, I think I'm going to send you a reminder note, okay? So that's the abdominal exam, great. Okay, now, let's start out with